Welcome back, and thank you for staying with us. In case you're just joining us, this is Daybreak. This morning we are talking about maternal health, just looking at the maternal mortality rates in our country and what needs to be done so that we can be able to improve in terms of the ratio. Just recently, the Kenya Demographic and Health Survey for the year 2022 was released that shows that maternal deaths dropped from 362 per 100,000 live births in 2014 to 355 per 100,000 live births in 2022. It's a drop, it's a reduction, but is it satisfactory? And what is it that we need to do so that we can increase the pace at which we bridge this particular gap? And that is why we have a panel of those who understand this subject most. We have from my far right there, we have Honorable Esther Okenyuri. She is a nominated senator and sits at the Senate Health Committee. We also have this morning Dr. Edward Serem, who heads the Division of Reproductive and Maternal Health at the Ministry of Health. Thank you, Dr. We have also Dr. Pamela Godia. She's a public health specialist, comes from the Liverpool School of Tropical Medicine. Thank you, Dr. for creating time for us this morning.
And the hashtag on Twitter is Daybreak. The SMS code is 22422 at Citizen TV Kenya, at Ayub Abdikadir, and at Safin_Cheng. We welcome your contributions as well here on the broadcast, and we will sample them towards the tail end of this program, and on Twitter, of course, and the SMS code as enlisted therein. Let's begin with you, Dr. Edward Serem, because you are the representative of the Ministry of Health here, and the stats mentioned and the mathematics by my colleague, it's over 8-year period according to the report that the Ministry of Health commissioned between 2014 and 2022, from 362 to 355. It seems a drop in the ocean, but how significant is this, and what policy underpins going forward to further lessen the numbers?
Thank you very much for this. As you have mentioned very well, my name is Dr. Edward Serem. I head the Division of Reproductive Maternal Health at the Ministry of Health. And as you've said, actually, maternal health is actually an issue in our country. And remember, Kenya is actually a signatory to the Sustainable Development Goals that the commitment is to reduce the maternal mortality. We are also, as a country, signatory to the ICBD, International Conference on Population Development 25. And the last summit was done in Nairobi in 2019. And the issue, therefore, is to eliminate preventable maternal deaths by 2030. As at now, Kenya is one of the countries which in sub-Saharan Africa which still has very high maternal mortality rates. Mm-hmm. And for this case, in 2020, in the last KD I just reported 365, the last census was 355 per 100,000 live births. Mm-hmm. And here, those ones are still unacceptable figures. And as a country, we've of course make sure that we make efforts, concerted efforts, to make sure that we reduce. And some of these concerted efforts are improving the quality of care. And some of these includes, of course, having the personnel who have the skills, improve the infrastructure. We are looking at the quality of care. We are looking at the commodities. Are the life-saving commodities available, including blood and oxygen? Are we having a proper referral system? That is part of the infrastructure. Do we have? Are we set up our medical? Our theaters? Do we have? Do we have referral systems? Yeah. From here, we are, on this note. Therefore, we look at the quality, because we really have to move on that. On top of that, we make sure that also that we empower, we capacity build the staff. All
right, pertinent questions you've asked there, and we hope that those questions will be answered before we conclude this conversation. But I'll just take you back, and this I'll rope you in, Mheshimiwa. Just looking at the drop, yes, it is a good thing, a sign that we are headed in the right direction, but I'm concerned that it's a reduction of only 7 in a span of 9 years. Should we be concerned?
Thank you again. I'm Senator Okenyuri. I sit at the Senate Standing Committee on Health. As we well know, health currently is a devolved function. As a Senate, we are generally oversighting what surely we are allocating to counties to support health. But when you look at the budget policy statement we were looking at yesterday, generally when we say we are giving more money to counties, but still, sadly, more money is still taken back to the national government. Is it a clawback to devolution? The essence of devolution was to have services closer to the people. Mm-hmm. But we are not having these services closer to the people, because in as much as we want the citizens to benefit from these services, we are depriving counties of allocations that would have otherwise beefed up whatever counties are already doing. You're seeing the strikes, what is happening. And on maternal health, I've had an experience of going randomly to some of these facilities. You go to a facility like Pumwani, 2 nurses are having to deal with 200 women who deliver in that facility in a day, serving a population of around 2 million people. Surely you do not expect these 2 nurses to serve all those people in as much as you want the mothers who've gone there to deliver decently, have whatever they need to have a decent and safe delivery. So the deaths we are having, yes, have decreased in number because there are efforts the government is putting in place. You know, government has had the Linda Mama program that is enabling women from all social status to deliver safely, whether you have the money or not. So long as you are enrolled in that program, you're able to deliver safely. But we are not seeing a very huge decrease in the deaths because, one, some of these issues are out of, women go to hospital and maybe before it's realized they are bleeding, because most of these deaths are happening between few days before and few days after delivery. So because of those few number of health workers, I'm telling you, you can't have 2 people serve the whole population there. By the time they get to the next very needy case that is available, maybe the mother has died or she has overbled. It's a worrying situation. Maternal deaths are regrettable. Okay. But I think this government is already moving in. You can already see from what the budget policy statement was suggesting. But I am warning that in as much as we have good intentions, I'm also worried that we are clawing back on devolution, looking at the allocations that were made. Okay. And I would also encourage that we come out and be clear on what exactly are we supporting on the health lines in the counties. Because you do not want, you keep saying you want health workers serve people at the county level, but you do not want the county government to employ these health workers.
But who, Senator, besides sitting at the Health Committee of the Senate, you are in a house that is a guardrail of the devolved system of governance, and you have talked about a clawback on the devolved system of governance. Even as they decry about the allocation to the county from the exchequer, is that amount going to the counties deployed for the right purpose? And why then the inability to absorb doctors even at the county level? Some of the functions are devolved, as you have stated.
Some of those functions are devolved, yes, but when you look at the major allocations are still retained at the national level. So, and this has been consistent. This is not the first time. When you look at the previous years, we've had the same trend whereby we say, yeah, 15% is going to counties, but when you now look at the general allocation, they're just playing around the figures to meet the 15%, but on the health sector, people in counties are suffering. I'm not defending the county chiefs, yes. I know we have wastage in counties, and you can see counties are accumulating large pending bills, which necessarily are not as a result of the disbursements they are waiting from the National Treasury. Some are because of county chiefs lying about their own sources of revenue, in that you're now committing on money that you cannot generate at that point. And as a result, we are seeing the wastage that we are witnessing now.
Thank you.
All right. Dr. Godia, you recently, you're part of a study that, addressed the same issue on maternal mortality. I don't know, from the survey that you and your team did, what trends are you picking up? What issues should we set aside as priority areas based on what you found out from the ground?
Yeah. Okay, thank you so much for having me during this breakfast show to discuss the work that we've been doing. As you've introduced myself, my name is Pamela Godia. I work as a part of the technical team at Liverpool School of Tropical Medicine, and I'm also a lecturer at the Department of Public and Global Health at the University of Nairobi. So over the past couple of years, let's say 5 years since 2014, we have been looking at files with the team from Liverpool School of Tropical Medicine and underfunding from the Foreign Commonwealth Development Office, that is the UK government, on just going deeper to find out what is really causing the death of these women. So we looked at files of mothers who had died from the year 2014 up to the year 2018, and it's still work in progress going on because we still have data which we have to look at up to the year 2020. So what's coming out from those files, because those are mothers who died from the major referral hospitals at the county level and also at the national level, including the 2 national referral hospitals, Kenyatta National Hospital and Moi Teaching and Referral Hospital. So we find that out of those close to 2,600 files we have assessed, majority of the mothers are dying because of excessive bleeding. Excessive bleeding is the major cause of death for mothers during pregnancy and childbirth. And it's across board, across the counties, all the counties. If you disaggregate the data that we have at county level, you'll find that excessive bleeding is the major cause of death. Mm-hmm. And then we have other complications arising from hypertension during pregnancy. Is also is the second most cause of death for the women, and the other third major cause of death for these women is other conditions which are not related to the birthing process, which we call things that come in due to complications that come in due to mothers having malaria, HIV/AIDS, and the tuberculosis. Things to do with other non-obstetric complications. Yeah, they come in as third. Going deeper, you find that majority of these mothers die after delivery. That is what we call postpartum. So they died after delivery, and the time window where majority of the mothers died, let's say close to 66% of the mothers who die, they die within 24 hours after delivery. So it just means that we have to be very alert. Yeah, we have to be very, very alert if we have to address the issues of maternal mortality and the morbidity that comes with that.
But why is this happening, Dr. Serem? Because we are recording progress even in terms of the births that are happening at the health facilities, births or skilled birth, if you like. 2014, it was 61%. In 2022, 89%. I mean, I thought by going to hospital to give birth, that increased the chances of safety for the mother and the child. What does it tell us about our health system?
Yeah, thank you very much for that. Maybe to add on what my colleague Pamela has said, the 5 leading causes of death is excessive bleeding after birth. That is the first killer of the women. The second one is, of course, related with hypertension, which is most of the time we call it preeclampsia, where during the process of the pregnancy, the blood pressure goes up and complicates. The third one is abortion complications. Remember, most of our teenagers are involved in issues of teenage pregnancies, and that one lead to unsafe abortions. That's the third cause of killer. The other one, of course, is obstructed labor. We have places where mothers, don't access theater facilities, because when you have obstruction of labor, when the baby is big, then you have to have a cesarean section, and some places you don't have. The fifth one, which you are calling the 5 big causes of death, is of course, infection. So all these are happening because of accessibility to the health facilities. Okay. Some of the counties, like now in the ASAL regions, they have to go for like 30 kilometers to access those facilities. Even though we are recording a significant increase in the antenatal clinic attendants and skilled birth deliveries, yes, there are still those small portions where, of course, they don't access the facilities. 2, the health workers are not enough. 3, the referral mechanisms are not good, and there will be all those brings about delays. And as you said, we have said that pregnancy and delivery, it has to be within a very short time. And if no intervention is done, then that's it.
Okay. But Dr. when you talk about proper health facilities, and you mentioned the counties, the Senator is concerned that a large chunk of the money, despite health being a devolved function, remains with the national government. You work with the Minister of Health, of course, based at Afya House. And then from the policy perspective, is this a discussion you are robustly having to think about more resources committed to health at the devolved unit, so that the healthcare centers you talked about are better equipped and people can access medication?
Exactly. That's exactly what the discussion which you are entertaining. And remember the Abuja Declaration, where all the African states, they commit 15% of your national budget to health. Right now, my colleague here, Senator, we at the national level we are now doing about 8%. Okay, and remember. That does not include now the contribution from the counties. I know different counties allocate different funds to, a certain percentage on their case, and therefore on this, remember also the issues of the Linda Mama program, and also we the Linda Mama program, and indeed the Linda Mama program contributed to improved skilled birth attendants. Skilled birth attendants in the country. That one is suffice to say that once you offer free services to the women, they will go to the health facilities, and that is now the agenda, which is now gaining momentum on the UHC. I think a lot of reforms are going to happen on the UHC, and I'm sure, and the President himself have mentioned that we would like to make sure that UHC works, such that everybody walks to the hospital without paying any funds. So I'm sure those are part of the discussions which are going on at eye level, and we know that in the near future, the issues of maternity and even health care for the country will be accessible to all the Kenyans.
And I would also want to comment on what my colleague Dr. Serem has mentioned on the teenage pregnancies and abortion we are seeing. It concerns me because as a legislator, I'm also a young woman who falls in that bracket. We are having many of these young women or teenage girls get pregnant and then procuring abortion in areas that are not, with doctors who are not very qualified, because we well know abortion is illegal in Kenya, not unless under medical advice, which in rare occasion does happen. So I would advise maybe if we sensitize the populace that surely you can avoid getting pregnant, but you know when the discussion about contraceptives comes about, Kenyans are generally a conservative community. and funding on reproductive health comes with conditionalities. Sometimes some of these conditions involve training people on even accommodating LGBTQ issues, which people like the church will not have a buy-in to that. So, and the moment the church is not subscribing to what you're trying to educate the general public, you're missing, because generally we are religious people. And the moment the church and we as religious people are castigating the whole thing, we are going to have more of most of those young women engaging in abortion. And we will have an increase in those number of maternal deaths we are recording. So
what then do we do?
Then we need to make it, we need to make the issue of young people getting pregnancy not look like it's criminal. You can deliver. If you've gotten pregnant, fine, you can deliver and celebrate your band of joy. But if there's something else you can do to avoid getting pregnant, we have the contraceptives debate we are having, and we're encouraging that people who are within that age can embrace those methods, because that it's an issue of try and error at times also. You might try the contraceptives and then you don't give birth again. So there are so many, but my point of view would be not castigating, especially when the young people get pregnant, because when you do that, then you're going to encourage them to undertake abortion, because they fear how they are going to be perceived by the society. So maybe encouraging them that, yeah, this has happened, but there's a way we can still move on. You can actually celebrate your bundle of joy and not be castigated by the society is one way of dealing with it, other than just say it's wrong, people will not pick it.
Okay, but okay, just Senator, this is the challenge here. Pregnancy is the variation factor here. The constant element of it is what next after the pregnancy. Because upon that, the responsibility falls on the government to offer service, because the people of Kenya have the right to be given services at public hospitals or otherwise institutions. Then how can we address the problem after the pregnancy? Because that is the discussion that we are having, so that it becomes a right and we lessen the numbers that we are talking about.
But you know, the government cannot come in and say the young people should not engage in sex. We already, actually, I think the recent statistics show that very many young people are using contraceptives. So in as much as we do not want to engage in that debate, the realities are here with us. People are using contraceptives and they'll get to our hospitals, but the government cannot say you're not going to engage in sex. They'll only try to make it, you know, very favorable for you the moment you are at that point. This is a young girl who is already pregnant. In as much as you want to castigate the whole process, she's already in that, she's already at that state. So the only thing you can do is offer them the services you would have offered any other older mother, other than castigate them in totality, because that is what is contributing to the high abortions we are seeing, which are one of the leading reasons to the maternal deaths we have.
Yeah. And I would agree with you to some extent, and because studies have shown that pregnancy-related complications are the leading cause of death among girls aged between 15 to 19. But then again, this I'll direct to you, Dr. Serem.
Yes.
At the Ministry of Health, you've come up with an adolescent and youth, a policy that touches on the reproductive health for this very special population. Does it address the realities that the senator is bringing out, and also the realities of our culture and our we are very conservative, we are very, does it address both divides? There is this reality that young people are becoming increasingly sexually active. There is also that other reality that in our culture that is still being treated as a taboo topic. Just what's the catch in this policy document?
Well, thank you very much for that. And it's in the adolescents and youth. Okay. Where I'm in the division where I head, that is part of my programs. And on this, therefore, addressing the issues of teenage pregnancies and abortion. This one, of course, requires, first of all, to address the issues of moral decay in our country. I think we have to put all the interventions to address that. And this one involves social and behavioral change. And I think that is our first intervention. As a country, we have to advocate for that. And one of the issues of addressing that, social behavioral change, is, of course, giving girls and boys education, information and education. From Minister of Health, we've designed, and we are now disseminating a book called Understanding Adolescence. And in Understanding Adolescence means that we want, and this one has already been adopted by the Minister of Education, that we want to make sure that the young boys and the girls in primary and secondary schools have basic informations. And these informations, it concerns about adolescence, their changes in the body, menstruation, and all those kind of things. And our advocate is to make sure that we bring the information to delay sexual debut. I think that is some of it. I mean, avoid issues of drug abuse. I mean, we are talking about bringing programs which will make sure that the girls are engaged throughout. Okay, some of the social decays we are looking at, which we are experiencing now, which brings about all these problems, where we are saying we have abortions. Is, I mean, so those ones in the slums, the girls who have been neglected, they don't have enough care. So we have to have programs which will make sure that the girls are taken care of. Because, I mean, our Children's Act is very clear that a child is anybody who is less than 18 years old. And that child, you cannot give anything without the consent of either the parent or the guardian or a children's officer. So those are the issues which we are talking about. As of now, the policy, as for where we sit,
all right,
we work on rules and laws, and those are some of the issues which are saying girls who are under 18 should not be given contraceptives. Okay. Yes, and it stays that way. And at the same time, the studies which have happened is somebody does not become an adult after 18. Somebody becomes an adult, mature adult, after 24. So in between year 18 and 24, okay, even though you are calling those ones children, no, they still require, those are the people who are supposed to be in colleges. They are supposed to be engaged in activities which will keep them busy.
Okay. Yes. Thank you, Dr. Ari.
Senator, I'm just tempted to ask you if what Dr. Ari is describing can happen.
About
that will respond. Okay. Thank you about that. We'll respond to that when we come back.
Take the account of Dr. Pamela Godia as to the data, because what we key in informs the policy decisions by the government, and to be specific, the ministry where Dr. Serem serves at Afia House, and the place of community health workers and volunteers who will be, of course, embarking on the door-to-door campaigns to ensure that they inform the mothers and the women across the country as to the importance of maternal health. We as well welcome your contributions. The hashtag on Twitter is Daybreak. The SMS code is 22422 at Citizen TV Kenya, at Ayub Abdikadir, and at Safin_Achieng. We are back after the break. Stay tuned.